All right, and our last topic, question 1. What do you think are some common signs or symptoms that women experience that indicate menopause will soon occur?
Irregular periods, light periods.
Mm-hmm.
Let's see, more constant mood swings.
Versus the usual ones, right?
Like versus like the PMS kind of mood swings, I would say. You know, more less subtle, more. I can't find the word right now.
Cold flashes.
Hot, cold flashes.
I was gonna say hot flashes.
Okay, that's pretty good. Number 2, what are some ways that you believe these symptoms can interfere with a woman's life?
Self-esteem. You feel you're getting old. You feel these, like the signs. They're pretty much common knowledge, and you start feeling them. It's like, oh my God, it's happening to me, and I'm getting old.
Mm-hmm.
Probably just that, I don't want to say stigma, but I kind of do want to say it, because just the stigma of knowing, you won't be able to have children, and that's associated with older age, and, that may be something difficult to deal with when it's approaching.
Okay. And do you think that all, most, some, or few women find these symptoms to be psychologically distressing?
Most.
Most. Okay. Now, are any of you actually looking forward to menopause?
No.
Not yet. Not yet. I'm a little too young.
Little too young.
Just the whole concept or thought of the hot and cold flashes after witnessing my mom go through that.
Okay, so
Not excited about it.
how would you describe your personal feelings towards that stage of your life, coming towards you slowly, but, coming your way?
I mean, I don't think I have a actual specific feelings towards it. I see my grandma, and she's happy. She doesn't. She has her ailments and she has her lashes here and then, but she seems happy.
Mm-hmm.
But then I see other women that are just miserable.
Mm-hmm.
So I think it's really individual. It depends on how you look at it, not just physically, which can be mediated with medication if necessary, but also psychologically. What kind of effect does it have on your, view of yourself as a woman,
Mm-hmm.
view of yourself as someone that's not old.
I think it also depends on where exactly you're at in life. Because I think, say for instance, witnessing, as I said, what my mom dealt with, she was totally excited about the whole idea of not having a menstrual cycle anymore, because it was just,
It is exciting, right? After
a
a
real
lifetime.
irritation to her. But then again, she had already had kids, myself and my younger sister included. So for me, if I had already had children and experienced that course of life and was approaching menopause, I'd be okay with it too.
Right.
Not looking forward to the hot flashes and all that. But then again, if I hadn't had children, it would probably induce a little bit of anxiety for me. It would make me feel like I needed to rush, because I do want to have children at some point.
Mm-hmm.
So it could be it depends on where you're at in life, I would say.
So I'm curious, Alyssa, you had mentioned that you don't want to have kids, right?
Yeah.
So how do you feel about having periods in general? Do you think it's completely pointless then, especially for you, or?
Yeah, it's nonsense.
Right.
And I really don't want them. Don't think I need to have them. The PMS symptoms are extremely bad, so it's I'd rather just be in that period after menopause.
Right. So you're kind of in a way looking forward to the end of this whole cycle. Okay. And let's see, what are some ways for mental health professionals to best help women who are distressed by the thought of menopause?
I think just encouraging them and letting them know, reinforcing that this is a normal part of life, that this is going to happen. It doesn't take away from your womanhood or who you are. This is just something that happens, and hopefully that helps them or assists them with coping with it.
Mm-hmm.
Yeah, I totally agree with Shara. Everything she said.
Yeah, I think it's mostly the reassuring that this is a completely normal step in life for women, and it's nothing to be ashamed about. It's nothing to be overly concerned about. It's just one of those things you have to pass.
Okay, and do you think that, are there any strategies of how we can improve the idea of women reaching menopause, improve the concept of that in our overall society? Because right now, it's pretty negative, right, in general. So how can we change that stigma? What do you think can maybe mental health professionals do, or the media?
Media?
Any suggestions?
The media can stop putting all those negative commercials about, well, if you have this side effect, you can take this medication. You have this side effect, you take this medication.
Yeah.
And it just makes, menopausal women look like they're just overdosing on every possible drug because they're trying to stop all the symptoms. No, I think it needs to be like a connection with the fact that some symptoms are natural, and there shouldn't be such a big kind of push towards, well, you don't have to feel this way. There's medication for it. No, it's a natural occurrence, so you don't necessarily need medication. And the fact that it's all over the media constantly, I think, really adds to the stigma.
Okay. Thank you so much for your time. Thanks, guys.
You're welcome.